Today I'm going to cover some of the questions that came up from my last week's video around about UTIs and using topical vaginal estrogen therapy. One of the main questions that came up was, even if you have had breast cancer, if you're at a much greater risk of developing breast cancer, is it a risk for you to use a topical estrogen vaginal therapy? And the general consensus is no, it's not. Now, this is a tricky one because literally everything you put into your skin or onto your skin gets absorbed by the skin. But all the people who I've heard so far, and admittedly they're doctors, they are not the sort of the wider holistic health community, are all saying that the vaginal topical estrogen therapy, the cream, the gel, the pessaries, whatever you might use, is safe to take if you're either at higher risk of developing breast cancer or you have had breast cancer. So in that instance, I would definitely have a very detailed talk with your oncologist or your health practitioner and go over the various options available to you, because there are different types of creams and gels as well. There's the Estradiol gel, which contains more estrogen. There's the Estriol version, which is a sort of lower dose version. It's a slightly different version of estrogen as well. So I think it's really important that you're having these detailed conversations with your healthcare provider so that you actually feel safe and secure, and you know that they are answering the questions that you need to get answered in order for you to think, okay, I'm getting either recurrent UTIs, I've got painful intercourse, various issues are happening down below, I'm too dry, etc. If that is a problem for you, then it sounds like it's a completely safe therapy that you could take regardless of your breast cancer or your blood clot or your stroke risk. Also, on the labels, when you look inside the labels of the sort of contraindications for these various gels, creams, pessaries, etc., they come with pretty significant health warnings, which means that even the low dose topical variety, so the topical basically means you put it onto your skin, it's a localized therapeutic intervention, that those go bundled in with the systemic hormone therapy, which is basically the patches, the pills, etc., the traditional bioidentical or hormone replacement therapy that you would have for all of your overall menopause related symptoms. Many doctors and women's health experts are now campaigning to have that leaflet adjusted or reworded, because I think a lot of women are seeing it and rightly thinking, oh my God, no, the risks are like far outweigh, the increased risk of a UTI, for instance, and then they're becoming poorly. And in actual fact, it's something, they could have avoided the UTIs, they could have avoided the various problems that they're getting by not being scared off by the doom and gloom and these really severe health warnings on the leaflet inside the packet. I'm going to leave plenty of links to references and research that I have done around this subject so that you can take a closer look yourself as well. Also, some of the comments that I received after doing last week's video was the fact that some women are having great results on it, and that's really, really heartening. Others were saying, oh, I've been taking it for a couple of weeks, or I've been taking it for 3 months and I've still not noticed any difference. Often that is because it can, depending on the type of treatment that you're taking and also your individual circumstances, it can actually take quite a long time. I've read up to 9 months for these things to actually kick in and work effectively. So if you're newer to it and you're still not noticing that much difference, it might just be that you need to take it for a little bit longer. That brings me on to the next thing. Was quite a few women have been getting thrush as a result of taking the topical vaginal estrogen therapy. That is quite a normal side effect. And the general consensus is that you keep taking your therapy. You may want to sort of back it off a little bit, reduce your dose slightly, but essentially what happens is, because as our estrogen levels fall, the pH balance of the vagina also changes, so it becomes slightly more alkaline. So when you start taking the topical vaginal estrogen therapy, that is then readjusting the microbiome of your vagina. It's making it slightly more acidic, and that process is going in the right way, but it might may mean that you're getting thrush for a short period of time while the vaginal microbiome is making those adjustments in its acidity level. So again, it's if you're worried about it, I would definitely talk to a healthcare provider about it. But thrush is not uncommon when you're taking topical vaginal estrogen therapy. In my video last week, I did do quite a bit on skepticism because, like you, I want to know that if I'm going to be taking something, is it actually safe? There is a lot of skepticism, there's a lot of distrust out there around the medical community, and I think it's really important that we take an unbiased view, because whatever you're looking for, you will find something that supports both camps. So it really is about you doing your own due diligence, and I know that can be onerous and it can take time, but if it's a concern of yours, I would definitely do some background research and take a look at the links that I've added below, because I'm trying to be as unbiased myself. I have never used the topical estrogen therapy. I have never used HRT, so I cannot talk with my own personal experience of it. I'm a firm believer that whether you take HRT or whatever your issues are, lifestyle plays a massive role into how you manage your symptoms. And I know for sure, because I've worked with so many women through the menopause, doing it the holistic way. I'm a psychotherapist. I've been a psychotherapist for over 20 years. I'm absolutely fascinated in how the brain and the body work. And having gone through perimenopause myself and didn't really get the care that I hoped that I would get from my doctor either. So I've literally dove into the research, and it is absolutely fascinating. The thing is, there is no one size fits all treatment, it would appear. Obviously, a lot of the traditional doctors all are saying, yes, HRT is completely safe and you should be using it, or obviously with the breast cancer indication, or possibly the risk of blood clots and heart disease, then you would have to have that conversation with them. But as far as the topical, so literally just the cream or the gel that you're putting on a specific area of your skin, that is supposed to be safe. But always do your own research on it. I've added a couple of articles below as well, and that will help, I think, you see the situation that some of the doctors are under. And it's very important that you have a full understanding of maybe some of the stories that you might hear in the press, and real stories. When I talk about antidepressants and suicide risk in menopause, if you have low mood associated with menopause, HRT is proven not to be effective directly if you're struggling with depression or high levels of anxiety. And there are terrible stories of women that have been given the wrong treatment, and they've sort of been brushed off, and eventually they've actually taken their life. It really is down to us to either support those we love if they're in a situation where they're unable to, they're just too broken. So really challenge, if you can go in and even be part and parcel of that conversation, even though it's so difficult because of patient confidentiality and it's really important that we do advocate for ourselves as much as we can. And so have a look at the links beneath this, because it is very important that you have a full understanding of what incentivizes medications to be created, to be prescribed. And there's a true story that's been barely spoken about. From 2004 to 2019, the NHS, so if you're watching this away from the UK, it's our National Health Service, ran what you would probably call a national experiment called the QOF, so the Quality and Outcomes Framework. It paid GPs, so our doctors, to monitor certain health markers, things like cholesterol, blood pressure, blood sugar levels, and prescribe drugs to bring those levels down. The idea was to test and treat early to then prevent future diseases occurring. But here's the thing. So when the results of this were published in the Lancet, and link to that is below as well. They found no improvements in life expectancy, hospital admission, or mortality. What did increase was prescription for certain drugs like statins, blood pressure meds, and diabetes drugs. Those, in fact, doubled in the amount that they were being prescribed. Antidepressants use rose by 60%. This is the scary thing. Hospital admissions due to adverse drug reactions to what they've been prescribed raised by 75%. Many people, especially older adults, ended up on something like 5+ medications. And I would encourage you to read the comments beneath the Health Insight UK blog written by Jerome Byrne, because those are written by people who really know what they're talking about, and they're very measured comments. It's not the sort of typical rubbish that you get out on social media. So I would definitely take a look at the full article. It's a practice called polypharmacy, and that can end up in a cascade of you taking drugs. So maybe you take one drug to bring down your cholesterol. So say you're given statins, for example, and then you're prescribed an anti-inflammatory because you're getting muscular pain as a result of taking the statins. But that anti-inflammatory then raises your blood pressure. So now you get put on a blood pressure pill that then leads to gout. And then that can lead to raised blood sugars. So then you are put onto a pill for diabetes. And then that pill for diabetes causes diarrhea. So then you put onto another pill. I mean, that's a very extreme example. However, you can see how easily these things mount up. And, from personal experience with people that I know, they're put on one thing and that causes another thing, and then that causes another thing, and that causes another thing. And, particularly in the cases that I'm familiar with, they've been put on an antibiotic and then something else, and then an antibiotic for something else that has caused, and their whole gut microbiome has been killed off by just pumping the body over months and months and months full of antibiotics, where in actual fact, if they'd dealt with the initial cause of the problem needing the antibiotics, it would have been fixed and they would still be here, and they're no longer here. It really is taking a holistic approach, as well as understanding the power of medications when they're needed. The results from this 15-year QOF scheme resulted in prescriptions tripling in those 15 years. Hospital admissions, like I mentioned, went up by 75% because of adverse drug reactions. And in one study, a care home decided to actually cut the drugs that a lot of their elderly patients were taking, and they saw a reduction in mortality from 45% down to 21%. So overprescribing drugs is not necessarily the way forward. And it makes you wonder why we keep getting prescribed various drugs and medication. And I think it's easy to blame doctors, but it's because the system is built this way. I believe that even if a doctor feels that a prescription isn't necessarily the right way forward, for one, the patient expects the prescription. It's a bit like antibiotics. They have a virus and they want that antibiotic to fix the virus, but viruses do not respond to antibiotics, only bacterial infections. So the doctors are struggling with a population that perhaps doesn't understand medicine, obviously, as well as the doctor does, and has expectations that they want fulfilled. But also, I think there is a case where doctors feel that they may be leaving themselves legally or professionally exposed if they actually do not offer the prescription. I think most GPs agree that polypharmacy isn't the way forward, but feel powerless to change it under the current guidelines and legislation. So it really is a grassroots issue. It needs to change from right at the base. And probably I would imagine politics needs to change as well, because it all seems very interrelated. One thing before we finish, I want to address an issue that people have asked me about. Can you use vaginal estrogen cream on your facial skin? And there's a lot of influencers out there on YouTube, in social media now, using it and saying that they're having great benefits from it. You have to have a prescription in order to be prescribed to get these various creams. And the Estradiol and the Estriol were both examined under various studies. I will also drop them below. But Estradiol 0.01% versus Estriol, which is a slightly weaker version of 0.3%, Estriol seemed to get a lot better results in just reducing wrinkles, reducing the appearance of pores, improving the skin sort of radiance and youthful appearance. You need a prescription to get it, but the problem is with a lot of these influencers, because I was thinking, oh, maybe, that would be great to try. Like I said, I don't take HRT, but yeah, I'm always keen to think, well, if it can make me look a little bit younger, that would be great. I have jowls. I mean, my skin isn't too bad. I'm 54, about to turn 55 in 2 days. It's coming up very fast. Well, I'm celebrating. I've hit my halfway point. I intend to live to 110. And so I've got another 55 to go. So I'm quite excited about that. But I do believe if you feed your body with healthy food like a human should have and move it like a human needs to and drink plenty of water and manage stress effectively and don't smoke and ideally don't drink alcohol, or if you do, reduce the amount that you drink or keep it fairly small. I really believe that that can contribute to a more youthful appearance. So going back to the videos, the influencers that I've been analysing and watching, they always tend to use, not all of them, but a lot of them will have the slightly darker before photo and then the much brighter after photo. And you just think, how can you even compare the before and after? Because it's so misleading, because automatically when you see the brighter after photo, you're thinking, okay, did they use a filter? Lighting can make a massive, massive difference to, how you appear. And then some of them are also taking, even if they're, they've really analysed their photos closely and they look very, very similar, the before and after. These people are also doing the infrared masks. A lot of them have Botox. A lot of them have had facelifts. And a lot of them also claim the castor oil thing is just a miracle. So it's a really hard one to know whether it's something that may improve your skin on your face or not. I would say if you're going to try something like that and you're happy to get the prescription for it, or your GP's happy to prescribe it for you, is to maybe do half of your face with it for 6 months and the other half leave it without the treatment, because then you'll get a really good idea of, is it working for you? Because if it's not, you're probably wasting your money. If it is working, then you can continue it. But it would be, I think if I were to do something like that, I would do half with and half without, because then at least you're getting a really good idea as to, is it actually having an effect on you? The thing also I just wanted to mention with castor oil, because again, there's so much out there on castor oil, and I watched quite a few of these things when castor oil was all the rage, and I think it still is the rage. Be interested to know, do you use castor oil? Have you tried Estradiol or Estriol on your face? Does it work? I'd be really interested to hear your feedback. But with castor oil, I add just a small amount to my facial serum day and night, and I don't think I've noticed any difference at all. Nothing at all. And there are people on social media who say, oh, I've rubbed it onto my abdomen and in 30 days, my symptoms of this, that, and the other were completely cured. I use it on my face and, within 3 months, it's miraculous. I've been using it now for about 2 years, and I use it because when I'm going up in the mountains and things, I think it does protect your skin because it's so thick and gloopy, so you don't want an awful lot of it. But there are people out there that actually literally slather it on their bodies. I mean, they must be so sticky. But I mean, I'm always open to hear other people's comments and what your experience is, because it might, like, I think certain things work for some of us and maybe others don't, depending on what your current skincare routine is, depending on what your current lifestyle is. Maybe castor oil has more of an effect on some of us more than others. I'm not sure. I know from my particular personal experience of it, I don't think it does me any harm. I think it probably creates more of a barrier to my skin against the harsh weather when I'm out walking in the winter. I don't actually think it's made any significant improvement to how my skin looks. But again, I'd be really interested to hear if you've got any comment on that. The bigger takeaway, drugs for prevention, particularly in older adults, do not seem to have the desired results that they thought they might in the first instance. We urgently need to shift the focus from test and treat to lifestyle approaches first, because so many of us are living unhealthy lifestyles and we're expecting these quick fixes. You have to live like a human and treat your body like a human first in order to experience any improvement, whether you take HRT or not, whether you're taking topical vaginal therapy or not, whether you're taking statins, drugs, anything related to any kind of intervention. If you're not looking after your lifestyle, you might as well just chuck it away, to be quite frank, because unless you're eating the proper food, unless you're drinking the water, unless you're prioritizing your sleep as well as you can do in menopause. And I'm going to do an episode on sleep very, very soon. Unless you're managing your stress effectively, the pills that you might take are like putting a sticky plaster on an arterial bleed. Get to the absolute root cause of the issue and be prepared to make some effort in order to help yourself. And I'm not saying you're not making an effort, just want to caveat that, but a lot of us are expecting the pills to fix us, and we have to start with lifestyle, no matter where your starting point. And self-advocate. So do your own research. Yes, it takes a bit of time. Yes, it might be a bit tedious. Yes, you might think, I don't really understand what that says to me. So try and find maybe an easier version if you're struggling with the medical and the therapeutic terms. But don't let that be the reason not to then do your own research. We have to advocate for ourselves, even if it just means that we have more confidence when we go to the doctor and they're having this conversation with us and we're thinking, actually, yes, what they're telling me is what I think I need to have. So you're feeling more informed, you're feeling more confident. And if the placebo effect ever works, if you've got confidence in your treatment, it's going to help kick in. It cannot do you any harm to have that positive placebo effect if you believe that the treatments that you're going to be given are actually going to help you. Our mind is incredible. It's so much more powerful than we think it is. And while I don't recommend getting any drug and then just believing it's going to work for you, if you've done your research, if you're feeling confident about what you need from your doctor, if your doctor is confirming that what you need is right for you, if you have confidence in that, I think it will make it even more effective than if you're going in thinking, oh, I'm a little bit doubtful. Is it going to work or not? So this isn't anti-doctor, it's not anti-medicine. It really is about pro-transparency and pro-patient empowerment. And as Byrne and Dr. Lefanu put it, the practice of chasing numerical goals for blood pressure or cholesterol is making many of us sicker, not healthier. We can do better, and it starts with asking better questions. If you want to read more, take a look at the links I've added below. I highly recommend you do. And if you try Estriol or Estradiol on your face, or you're a great fan of castor oil, please, I would love to hear what your experience is. It might help somebody else who's looking for similar support. And thank you for your company, and I look forward to chatting with you again next week.